Good morning, good afternoon, or good evening. I'm delighted to welcome you to this webinar on COVID-19 and forced displacement in the Global South. My name is Radha Rajkotia, and I'm the Chief Research and Policy Officer at Innovations for Poverty Action. And we're delighted to welcome you to what is the second in a series of webinars that we're co-hosting with our friends at the Center for Effective Global Action and the UNHCR World Bank Joint Data Center on Forced Displacement. So for those of you unfamiliar with IPA, we are a research and policy organization dedicated to discovering and advancing what works to reduce poverty. We work across 22 countries and focus on developing rigorous evidence for some of the world's most pressing poverty problems. And I can't think of a more pressing set of topics than what we're going to be covering today, which is both a combination of a COVID response, which IPA started earlier this year. We established the RECOVR initiative, which includes a series of country-level surveys, a global hub that centralizes research and recommendations and policy syntheses, as well as a number of studies that we have conducted with our academic partners and implementing partners across the globe. We also focus on equipping our policy partners with research and data that can help them make the most effective decisions on issues that they're facing. So now when today we're going to be focusing on forced displacement. We know that from the data, we know that this is one of the most pressing issues of our time, with over 70 million forcibly displaced people and over $28 billion spent in humanitarian funding. There is a massive need in terms of forced displacement and internally displaced solutions. However, there's also a dearth of rigorous evidence in terms of what can be provided. So that's what we'll be focusing on today, is drawing on some of the newest research that we have to combine the focus on forced displacement with COVID. IPA established a humanitarian and forced displacement initiative 18 months ago with an interest in both generating new research and evidence, but then also being able to equip decision makers with some of that. So with that brief introduction, let me go into just introducing our panelists today. We have with us Rana Samara, who is the who's the research director at Mindset, which is the leading research firm operating in Jordan and the Middle East. Dr. Nathaniel Young, who's the principal economist at the European Bank for Reconstruction and Development. He focuses there on topics in development, economics, and industrial organization. Dr. Sarah Baird is an associate professor of global health and economics at George Washington University and focuses on the microeconomics of health and education in low and middle income countries with an emphasis on gender and youth. And Samuel Leone is an economics PhD candidate at the University of California, Berkeley, and a consultant at the World Bank. His research analyzes factors affecting economic growth in the Middle East and North Africa. We're delighted to have them all with us today. And they will be speaking on different aspects of their own research. So Rana Samara will be setting the scene for us and giving some context on the effects of COVID and the lockdown in Jordan following the emergence of COVID earlier this year. Nathaniel will be focusing on some of the economics impacts of those lockdowns on vulnerable populations, both refugees and Jordanians. And Dr. Sarah Baird will be focusing on adolescents' experiences of COVID-19 in Jordan. Samuel Leone will be focusing on a very important and understudied area of intervention, which is housing assistance, and how that has emerged for Syrian refugees during the pandemic. Great. So with that, I will hand over. Rana, hand over to you.
Thank you, Radha. I'm just going to share my screen now. Hi, everyone. Thanks a lot, Radha, for the introduction, and thanks a lot for attending this webinar about this crucial topic. My name is Rana Samara. I am the director of Mindset. Mindset is a Jordanian social research firm operating in the Middle East and Africa. I am Jordanian and I work in the field of social research. Mindset, the firm I lead, had the honor and privilege of working with two of the three distinguished researchers presenting their research here today. This is why I guess I am here to give you a little bit of context about Jordan. Some of you may know a lot about Jordan, but today it is my job to try and tell you some parts of the story of refugees in Jordan prior and under COVID-19 to set the context for my colleagues' narrative and stories. Now, let me tell you a few facts about Jordan. Jordan is a small country located in the global south with a population of 10.5 million people. Jordan is a young country in the sense that it was established in 1921 and its population is also young, with 44.3% of the population aged 18 and under. To let you know a little about the timeline of refugees coming to Jordan, the first Syrian refugee came to Jordan in 2012. This graph is taken from UNHCR. Therefore, only accounting for registered refugees, you will notice that there was rapid forced displacement between 2012 and 2014, after which the numbers have stabilized. As can be seen, today the number of Syrians in Jordan is 1.3 million, according to the Department of Statistics, with 662,000 registered with UNHCR. Around 19% of those registered Syrian refugees, reside inside camps, leaving around 81% residing in host communities. Jordan also hosts Palestinian, Iraqi, Somali, Yemeni, and Sudanese refugees. As can be seen, Syrian refugees are disproportionately young, with half of the refugee population under age of 15. There is much to be said about host communities, and research was done on the resilience and response to host communities after the influx of Syrian refugees. While they have partly benefited from the presence of refugees, since international organizations focus both on refugees and host communities, many Jordanians feel they are worse off because of the refugee situation. Scarce job opportunities, hike in home rents, social conflict, in addition to straining the educational and health systems at times, were all issues arising as key problems. It also does not seem likely that refugees will be able to return back to Syria anytime soon, no matter how hard life in Jordan becomes, which extends the impact on host communities. Naturally, as the case is with refugees around the globe, the mental health become an area of focus and important area for study. According to a study conducted by ENFNet, psychological distress affected 56% of refugees, while the prevalence rate of PTSD and depression was 18% and 30% respectively. The most common stressor experienced by Syrians living in refugee camp is worry about the well-being of their relatives who have dispersed to other refugee camps or moved to other countries. Sam will also, in his presentation, will highlight newer findings from their research in Jordan. If we are to discuss education of refugees in Jordan, there is limited data. 56% of school-aged children amongst refugees are receiving formal education. These rates are lower than national rates in pre-conflict Syria. The predominant model for Syrian refugee education in Jordan has been integration into the Jordanian public school system, with parallel education system established for those refugees residing inside the camps. Now, if we want to talk about refugees under COVID-19, many citizens, of course, in the world have faced vulnerabilities for the first time under COVID-19. But for Syrian refugees, COVID-19 poses yet another thick layer of vulnerabilities on already existing ones. fear, instability, grappling to secure food and consistent income, lack of access to quality healthcare, have been a staple for many refugees ever since the crisis started, let alone under COVID-19. So as can be seen, unlike many other countries, if you can see with this chart, unlike many other countries, Jordan have only experienced a full outbreak of COVID-19 in August, as its initial response to COVID-19 was amongst the strictest worldwide, where the country underwent a total civil and economic lockdown. They also closed all airports and borders for 3 months, which resulted in a total case count of 1,200 only in that duration, and 2 fatalities. However, ever since August, Jordan has witnessed a surge in daily cases registered due to laxing of restrictions and allowing economic activities to resume, in addition to reopening of airports and borders. Today, we stand at a count of 240,000 registered cases and 3,000 fatalities. If we are to discuss a little bit in brief the refugees' economic situation under COVID-19, if we talk about the emergency response, the focus today has been and remains today more on emergency response than sustainable development due to several factors, amongst which the country's policies. And of course, there is a dire need for emergency response amongst the refugee population. As for the government response, it should be noted that the government of Jordan has launched several social protection programs through its National Aid Fund. None of those programs were directed at refugees, leaving the heavy lifting to international donors and agencies. Moreover, other key international players have had limited access to funds. UNHCR reports that only 17,000 out of almost 50,000 new identified vulnerable families under COVID-19 received emergency cash support due to limited funding. According to a study conducted by DRC earlier in the crisis, I think around March, 91% of Syrians surveyed are unemployed after the COVID-19 related restrictions. And according to another rapid assessment conducted by UN Women, 99% of refugees inside camps who were informally employed have lost their jobs. So as can be seen below, by the same study conducted by DRC, food, rent, and health are forecasted to become more pressing needs should the restrictions resume. So this is how it stood on the day of the survey, and the light pink is how it's forecasted to be should for another month should the restrictions remain. So of course, intersectionality of Syrian refugee women increased their vulnerability. 62% of Syrian women in refugee camp indicated they feel at increased risk of suffering psychological or physical violence due to increased food insecurity and increased tensions in the household. And this was particularly true for larger households. Additionally, 95% of Syrian women reported that as a result of the crisis, they are spending more time than usual caring for family members, including children and elderly. And this will inevitably result in their inability to reintegrate or enter the job market. So to discuss a little bit the education of Syrian refugees under COVID-19, as can be seen, there are around 231,000 school-aged Syrian refugees in Jordan. And those are who are registered with UNHCR. As the case with many education systems around the globe, Jordan has shifted to online learning. However, multiple barriers are hindering the commitment of refugee students to their education, such as limited equipment resources, their accessibility to TVs, laptops, phones, or tablets, limited network accessibility. And then there's also the forecasted long-term impact of the current setup. on the dropout rates beyond COVID-19. I believe a prime example that Professor Baird will explain is the worry of Syrian parents if their children who dropped out during COVID-19 will return to their education after COVID-19. So I'd like to tell you a little bit about research under COVID-19. Because we work with multiple partners such as UNHCR, WFP, and UNICEF on multiple activities, and we also work with the government of Jordan. So we saw firsthand how the halting of in-field activities for 3 months left many cases that needed assessment to receive their cash assistance unvisited and uncovered. So they did not go through the process of being validated, their cases and their appeals to be validated and to consequently to be receiving their assistance. Of course, there's also a challenge which is a real concern, that research activities moving from one house to another may contribute to the spread of COVID-19. Therefore, a whole new protocol was established and launched with the field force, but in-field data collection resumed since June, adopting those new protocols. Due to COVID-19, many face-to-face activities were transitioned to phone and virtual sessions, which maintained the data quality to a great extent. There was no major data quality. However, we experienced, it of course kept both staff and respondents safe, but it decreased the rapport that the researcher usually establishes with the research respondents, but also increased the respondent fatigue, which we responded with our partners to by breaking down the interviews. It was not ideal, but it was the approach to maintain the data quality. Of course, there's one note regarding research under COVID-19, which is there's abundance of research about the impact. However, there's sometimes duplication in research effort by different actors. And the hope is that synthesis and collaboration will take place to increase the impact of research. Thank you, everyone. I will hand back to Radha.
Thanks so much, Rana, for setting the scene for us. And we'll now move over to Nathaniel, who'll talk about some of the impact of the economic impacts of the lockdown.
Excellent. Thank you very much. Let me just share my slides.
Just while Nathaniel's getting that loaded, please do, for attendees, if you have questions, please do feel free to put them in the chat. And if we don't address them through the chat, we'll come back to them in the Q&A at the end of the session. Thanks.
All right, thanks very much to the organizers for this opportunity to present. This is work with Louisa Cefola, Michael Gechter, and Nick Sivanidis. We examine the economic impacts of COVID-19 lockdowns, focusing on Jordan. Before I start, let me say that the opinions expressed here today are my own and do not necessarily reflect those of EBRD. I also want to gratefully acknowledge financial support of this work from IGC and the Taiwan Business EBRD Technical Cooperation Fund. So by now, we're all very familiar with the fact that the global spread of COVID-19 has led to unprecedented and rapid policy responses by governments around the world. Lockdown policies save lives. This is something that we know, but we still do not fully understand the economic impacts that go along with them. We know even less about these impacts in low and middle income countries. This is because high frequency data are less available in these places, and groups such as refugees and informal workers make up a larger share of the population and may be particularly at risk and are also very difficult to survey. So this is why finding measures of these effects is so important. The goal is not really to argue that lockdowns hurt. I think that we know this and that we agree on this, but it's instead to help inform evidence-based policy, such as those that can precisely target social protection programs and small and medium enterprise support. So in this talk today, I'm going to talk about how we go about measuring this. I'll give a very brief overview of the aggregate impact from the lockdowns And then I will talk about the specific impacts for refugees in Jordan. Okay, so we examine these impacts. To examine these impacts, we conduct a phone survey of 4,000 respondents randomly drawn from accounts on one of Jordan's largest mobile phone operators. Anonymized data from mobile phone activity and tower coordinates let us assign neighborhoods of likely residence for these users, and that helps us to oversample Syrians that are both inside and outside refugee camps. Outside refugee camps means predominantly in urban settings. The survey was conducted in July to September 2020, and our questions focused on outcomes from before, during, and after the strictest lockdown in Jordan, which ran from March 18th to April 15th. We separately construct measures of mobility based on these mobile phone data I mentioned of use on the operator's network. So some key takeaways. One, the lockdown did have a negative impact on the economy that was partially recovered by September. So the unemployment share of adults in Jordan increased from 7% to 16% during the lockdown that lasted from 18th March to 15th April 2020. The share improved to 11% by September. Wage earnings decreased by 42% of pre-lockdown baseline levels on average during the lockdown, and these partially recovered by September, but remained 19% below their pre-lockdown baseline. Refugees experienced a particularly hard lockdown economically. Unemployment increased, hours of work dropped to just 9% of baseline levels on average, and earnings dropped as well. The refugees also experienced a shallower recovery. Employment hours and earnings remained well below their baseline into September. Finally, lockdown restrictions did reduce mobility, and more so for the rich. The number of trips taken per day, measured using these mobile phone data, fell on average by 57% to between 1 and 2 trips per day. So I'll first talk about the aggregate impact of these lockdowns. Unemployment increased during the lockdown and then partially recovered. This figure shows the share of the population in each economic status for both before the lockdown, during lockdown, and after. And we can see the negative impact on the share of employed adults. So these are adults in Jordan, age 18 and over. This began at about 50% before lockdown, dropped to 30% during, and recovered to about 46%. We could also look at the share of unemployed, economically active adults in Jordan, which just before the lockdown was at 7%, increased to just 31%, which is, increased to 16%, and then decreased to 11% after. Average earnings declined substantially during the lockdown and then partially recovered. So this figure shows the average percentage change in earnings for adults in Jordan who had had a job prior to lockdown, and that changed going into lockdown and afterwards. So during lockdown, the average percentage change, the percentage decrease in earnings was 42%, and this recovered partially to 19% after lockdown. This slide summarizes what I've just mentioned for the recording. Okay. Lockdown exerted particularly negative impacts on refugees, both during and after. Refugees were more likely to be unemployed during lockdown and less likely to have recovered a job by September. They faced the steepest drop in hours and earnings during the lockdown and a shallower recovery afterward. They were more likely to report food insecurities and to report borrowing money or selling assets in order to cope with financial hardship. And now I'll detail some of these impacts. So refugees faced a substantial job loss during lockdown and a shallower recovery after. Refugees were 73% less likely to be employed during the lockdown than before. Workers with low wage manual jobs experienced a similar decrease to refugees. Refugees partially recovered after the lockdown to 25% below their baseline level, while low-wage workers did slightly better, recovering after lockdown to 18% below that baseline. And to offer a contrast, having less than a secondary education made less of a negative impact on employment during and after the lockdown. Lower educated workers were 51% less likely to be employed during lockdown than before it, and just 13% less likely by September. Refugees experienced large drops in hours and earnings. In fact, refugees experienced the sharpest reduction in hours during lockdown of any of the groups that we examined. They worked just 9% of their baseline amount of hours on average during the lockdown. This number recovered to just 27% below their baseline hours by September, and their earnings tracked these losses quite closely on average. So their earnings dropped 87% below baseline during lockdown, and this recovered to 31% below the baseline by September. And we find that the experience for refugees was quite similar to workers from other groups that might be considered disadvantaged, but these other groups had less severe impacts. The other thing that we're interested in is measuring mobility impacts using these mobile phone data. So to do this, we construct measures of mobility based on mobile phone use on one of Jordan's largest telecommunications networks. Anonymized metadata of the mobile phone transactions, these are voice calls, sending SMS, and data activity, along with geo coordinates for the connecting towers of these activities, allow us to assign neighborhoods and tower catchment areas of residence for users, and then to detect the number of trips made by users per day. And for the purpose of this report, we identify a trip when a transaction occurs over a tower at least 1.5 kilometers away from that home tower of an account. Prior to lockdown, individuals typically typically took 3 to 3.5, well, on average, 3 and 3.5 trips per day. So this figure shows the average number of trips per user on the network per day for Amman from January 2020 through May of that same year. The dark blue line shows the average number of trips of per user per day on the network for users from the highest rent neighborhoods in Amman. So we consider these relatively wealthier users. The light gray line shows the average number of trips per user per day for people residing in neighborhoods that are lower rent. So we consider these poorer users. The vertical line marks the first case of COVID-19 reported in Jordan. And this light gray line is the dashed vertical line. The first one is an implementation of partial lockdowns, followed by the strictest lockdown on March 18th by the second gray line. So this figure shows 5 important mobility behaviors. The first one is that the lockdown was really quite effective in limiting mobility. We can see that the number of trips taken per day started out around 4 or so pre-lockdown. And after the lockdowns came into effect, this dropped to around 1.5 on average per day for wealthier users and to around 2 trips per day for less wealthy users, for poorer users on the network. And this gap is the second finding that I find quite interesting, which is that wealthier neighborhoods were able to reduce mobility or reduce mobility more during the lockdown. And in fact, this gap emerges at the time of the first case of COVID-19 in the country and expands after lockdowns go into place, and they narrow slightly as restrictions began to ease after mid-April. we see that there's no, you can't really distinguish between the two patterns of usage for the groups in the months before this first case of COVID-19. Finally, I'll note that the partial lockdowns did not coincide with as steep of a drop as after the implementation of the strictest. This might be because it took a while to ramp up mobility restrictions, or it may be that these strictest restrictions are really what drove these restrictions. I'll also say that the data coincides very well with reduced trips for periods of curfew, which are these fields of dark gray through here. So these are 24-hour comprehensive restrictions on mobility, and we see that the number of trips really plummet during those times. Again, these summarize what I've just talked about. And so we're very excited for where this project is going, and what we want to do next with this, and what we plan to continue doing into the future, is to trace this migration and the impacts on mobility, and also to trace out the recovery as we go out into the future. Our phone survey reaches enough Syrian refugees living in camps, but also in urban settings across cities, for us to be able to describe these experiences separately. And these mobile phone data analyses provide insights into these high frequency data on mobility and migration, which both reach back several months, but will also continue in the future. So we're going to be able to gain some very nice insights as to what is happening as people react and respond to these changes in mobility restrictions. How do they change where they live and work? How do these things evolve through time as people cope? And finally, we're excited for future survey rounds that will be following these same 4,000 respondents. And this is going to help us trace out longer term recoveries for refugees and incumbent residents to see how these recoveries may differ, what these look like. So to conclude, let me say that the lockdown did have a negative impact on the economy, which partially recovered. Unemployment increased dramatically during lockdown and then partially recovered. In September, unemployment remained at 11%, up from 7% of economically active adults. Wage earnings decreased by 42% of pre-pandemic baseline levels on average during lockdown, and these partially recovered after lockdown, but remain 19% below their baseline. Refugees experienced a particularly hard lockdown economically. Unemployment increased, hours of work dropped to just 9% of baseline levels on average, and earnings dropped. Refugees also experienced a shallower recovery. Employment, hours, and earnings remained well below baseline in September, and lockdown restrictions reduced mobility, and more so for the rich. The number of trips taken fell to between 1 and 2 per day. And for that, I'll hand that back over to the moderator.
Great. Thanks so much, Nathaniel, for sharing that. Right, so now that we've got a bit of the context set from Rana and Nathaniel, we'll hand over to Sarah Baird, who will look at this and will provide the perspective from the adolescent view. Thanks.
Great. Well, thanks so much for the opportunity to present this work today. So I'm Sarah Baird. I'm an associate professor at George Washington University, and this is part of a larger data collection effort, which I'll talk a little bit in a few slides, called Gender and Adolescence Global Evidence, which is trying to understand the lives of adolescents in a variety of contexts globally. I should note that this is, GAGE is funded by UK Aid and is led by the Overseas Development Institute in the UK. And I head up the quantitative piece of the work. And so today we're going to focus on our data collection in Jordan. We'll focus on Syrian refugees, but our sample also includes vulnerable Jordanians as well as Palestinian refugees. So what I'll do is walk through a little bit about why we should care about adolescents in the wake of COVID-19. Since I imagine many of you are new to GAGE, I'll give a brief overview of GAGE and then highlight some kind of key findings related to adolescent refugees in Jordan before concluding with a few policy recommendations that I hope we can discuss further in the Q&A. So as you all know, COVID-19 has rapidly disrupted the lives of individuals across the globe. And while the direct health effects have largely been concentrated among the elderly and those with underlying conditions, we all know that the virus will have multidimensional effects on young people. In particular, we're concerned around the impacts of school closures and sort of building on Nate's presentation on these sort of very large negative economic shocks. I'm going to go into much more detail in our sample, but just very quickly, 75% of our adolescents were in school when the COVID-19 lockdown hit in Jordan. And again, echoing Nate's presentation, 65% of households report losing unemployment permanently or temporarily, with higher rates among non-Jordanians. 70% of our households report some income loss. And so, you know, these school closures and these income shocks are substantial, and concerns around both short-run and long-term implications. In addition, there's concerns that these impacts may be particularly acute for adolescent girls, and so we need to ensure that we take a gendered lens as we look at the potential impacts for young people. So why are we focusing on adolescents, and why are we looking at the gender-specific effects of COVID-19? So first, some preliminary global evidence suggests that adolescents who are enrolled in school when the pandemic hit may now engage in paid work to help supplement these losses in income, take on larger roles in the household, become pregnant, or face pressure to marry. And all of these factors are going to constrain school return when the schools reopen. Moreover, adolescence is a time in the life course that is pivotal in terms of physical, cognitive, and socio-emotional development. And so impacts such as compromised nutrition, and inadequate social protection, which Rana mentioned in her introduction, may be particularly consequential for young people. Moreover, we also know from previous pandemics, such as HIV, Ebola, the 2007-2008 global financial crisis, that children and adolescents are likely to face multiple interconnected and gender-specific shocks. There's a good deal of evidence, you know, although COVID is clearly unique, there's a good deal of evidence from previous crises on the gendered impact in terms of increased burden of care work for women and girls, disruptions in SRH services, and increase in domestic violence, all of which are likely to prevent particular challenges for girls. Moreover, in the case of Syrian refugees and other refugee populations in Jordan, these challenges are going to be further exacerbated, right? Because not only are they facing the challenges of being a refugee, they're now compounded by these additional challenges. So before we get into some of our COVID findings, I want to talk a little bit about GAGE and provide a bit more detail of our sample in Jordan. So GAGE is a 9-year mixed methods longitudinal research program exploring the gendered experiences of young people aged 10 to 19. And so this began before the COVID pandemic hit. We aim to find out what works for whom, where, and why, so we can better support adolescent girls and boys to maximize their capabilities now and in the future. We are following 20,000 adolescent girls and boys globally, including our sample in Jordan. We are currently undertaking COVID-related research in a number of these contexts, most notably Palestine, Jordan, Ethiopia, and Bangladesh. And I hope in our discussion, we can talk a little bit about some of the similarities and differences we're seeing for young people globally. In Jordan, we have a sample of approximately 4,000 adolescents. And along with quantitative surveys with young people, we also survey parents, community leaders in schools, and combine this with qualitative research and participatory research that allows us to get into a bit more detail about what's going on in these adolescents' lives. And throughout the talk today, I'll both be sharing some quantitative findings as well as provide some illustrative quotes from the qualitative work to provide a bit more nuance. So this is where we're working in Jordan. Our sample includes Syrians, Jordanians, Palestinians, as well as a handful of other Iraqis and other nationalities. We work in the camps, so in Zatari and Azraq camp, which are two of the main camps for Syrian refugees, as well as in Gaza camp, which is a Palestinian refugee camp. We also work in informal tented settlements where a lot of very vulnerable Syrians reside, and we'll see that vulnerability highlighted in our findings. And then we also work in host communities in Amman, Irbid, Mafraq, and Zarqa. Our sample includes girls and boys from 2 main cohorts. So those are 10 to 12 when our research started in late 2017, and those that were 15 to 17. We also oversample adolescents with disabilities and married adolescents to ensure that we have a large enough sample in these vulnerable groups to be able to share findings on them specifically. I also should note that this work is done in collaboration with Rana and Mindset, as well as a large host of other collaborators. And I guess the one other thing to note here is that if you're thinking of kind of who is this sample representative of, in camps, it's really representative of young Syrian refugees in camps and in ITS. And in host communities, you should consider this representative of vulnerable adolescents in host communities. So in terms of our overall sample, we have a sample of a little over 4,000 who were surveyed for the first time in 2018, 2019. As I noted, they were largely 10 to 12 and 15 to 17 at that time. And we also surveyed primary female caregivers. We were actually about to launch our second round of our longitudinal survey in late February, early March. And I was actually with Rana in Amman at the time. And then we very quickly had to shut down those plans, but we're able to pivot to a COVID-19 virtual survey, which took place between May and July 2020. We successfully surveyed 3/4 of the sample, and overall they look fairly similar to the sample as a whole. So happy to talk more about that later as well. And as Rana noted in her introduction, during the time data was collected, Jordan recorded about 594 new cases and had only 2 deaths. And so our findings should be seen within the light of that initial very sharp lockdown and what was happening around that time. We are currently in the field for a second round of COVID-19 virtual surveys to try and understand the dynamics around the impact of the pandemic and hope to be able to share findings from that early in the new year. And this quantitative data is supplemented with 100 virtual qualitative interviews from a subset of this sample. To also note, the research obtained ethical clearance, both from local Jordanian authorities as well as from George Washington University. So we have a lot of findings, and I'll share the website on the final page where you can find both journal articles and policy briefs related to this work. And so today I want to really quickly highlight some findings related to household food security, adolescent education, time use, mobility, and social isolation, as well as violence. I won't go into a lot of detail into how the measures are constructed, but again, encourage you to go to the briefs or follow up with me by email if you have any questions. What we are largely going to do today is just provide some descriptive analysis, comparing means of variables of interest, controlling for pre-COVID-19 covariates. So because we have this panel data, we can control for a number of factors pre-COVID to help get a better sense of what's just things happening over time versus what's actually the impact of COVID. We'll highlight heterogeneity according to nationality and gender. Again, we'll reflect Nate's findings that refugees seem to be suffering more than Jordanians, even though everyone is suffering a lot. And again, this is just going to be a small subset of our overall findings. All right, so let me get into some of our results. So as I noted, I want to first talk about food security. So, and again, so here I'm going to focus largely on refugee adolescents. And remember, this is about 85% Syrian and about 15% Palestinian and other. And so these findings should be considered representative for Syrian refugees as well. So 31% of refugee adolescents report being hungry in the past 4 weeks, with 16% indicating that this has become higher since the onset of COVID-19. 48% of refugee adolescents report that their meals were less likely to contain protein compared to before the pandemic. And primary female caregivers report that they are cutting back on food to both boys and girls. And so you can see that the economic shocks that Nathaniel talked about have transmitted themselves into concerns around food security. And all of these numbers are higher among the refugee population than they are for our vulnerable Jordanian sample. So looking at education, so about 73% of our adolescent refugees were enrolled in any school. So this is formal as well as the informal, non-formal schooling that is offered in Jordan prior to COVID-19. Just to note that this compares to about 88% of Jordanians. So again, highlighting the vulnerability of the refugee population. However, this number was only 54% in informal tented settlements. And the reason I want to highlight this is that it just shows that, even within the Syrian refugee population, there are sort of differences in vulnerabilities. And let me just read this quote from a 12-year-old girl living in an informal tented settlement. She notes, "I used to go to school, now I only study at home. They sent us a message and told us it is now through the internet. In our tent, only my dad has a phone. We do not know how to study alone, and I do not know if they stopped giving lessons or not." And the reason I want to highlight this is I think that this points to the fact that there are going to be huge concerns about access to learning and other support during COVID-19, exacerbating pre-existing inequalities. Now, that said, Jordan has actually done a remarkable job of pivoting to online education. So 75% of our sample use internet or media to continue learning through the Ministry of Education's online service and national TV channels. And this is much higher than we've seen in other countries where we're doing research. But even still, as this 13-year-old Syrian girl from Irbid notes, the lessons are very difficult and the teachers don't know how to explain things clearly for us. I can't understand the material and teachers don't provide enough detailed explanations. So again, even though I think Jordan has done remarkably well in terms of pivoting to online education, young people are still facing some challenges. Now, interestingly, the adolescent girls and boys themselves are not concerned about returning to school. Most of them want to return, and almost all of them say they don't think it'll be challenging. But close to 70% of their caregivers are concerned the adolescent won't return to school. And so it's concerning that parents are feeling this way. And I'm very curious to see what we see now when we go back to the field of whether this has changed at all or whether these concerns still remain. Another highlight from our findings is the importance of adolescent programming. So prior to the pandemic, UNICEF's Makani program provided informal learning support classes combined with psychosocial support, child protection messaging through a network of community-based centers that really helped adolescents who are not in formal school to continue their learning and then ultimately connect to formal education. What's impressive is that when the centers closed, the facilitators were actually able to very quickly adapt to move their learnings online. And so even though the centers closed, they're still disseminating information on the virus, distributing hygiene kits to the most vulnerable, learning support groups via WhatsApp, and messaging to parents on how to support children. And as you can see, a decent quarter of our sample were attending Makani when COVID hit. And out of these, many are still receiving support or engaging, which for kind of informal education is quite impressive. And as this 12-year-old girl from Zatari notes, this support has really kind of helped her engage with learning while schools were closed. One of the reasons this program was able to transition so quickly from in-person to online was because it has a large frontline staff that live in these communities, in the camp and host communities, who were able to quickly adjust to the local conditions on the ground. And it shows the importance of having these networks for programming to be able to adapt quickly to these kind of crises. Okay, so I know I'm almost out of time, so let me quickly run through my last couple of slides. So another thing that's really important for young people is kind of time use, mobility, and social isolation. And I think this is also where a particular gender angle comes in. So what we find is that young people report doing a lot more chores and taking care of young children. And although we don't see gender differences here, this is on top of very strong gender differences at baseline, right? So girls were doing a lot more at baseline, and now these increases appear to be, it's found by everyone across the group. Second, we find that adolescents report massive restrictions on mobility and privacy. Again, not surprising given that the very severe lockdown in Jordan and the fact that these adolescents are kind of now, mostly stuck at home. There is a gender angle, however, when we look at, what access these people do have to the outside world while they're home. Older males are much more likely to have access to technology than older females. They're more likely to have interacted with a friend in the last week, and they're much less likely to have stayed home. So in our sample, 54% of older girls have not left their house in the past 7 days compared to only 19% of boys. And I think, given the importance of social connectedness for young people, this has the potential to have long run psychosocial costs for this population where we're going to need a policy response. And I'm not going to read these two quotes here, but these are two quotes just sort of describing the particular challenges of women, of girls during this crisis. I've run out of time, but here's just a quick highlight that violence has increased dramatically, stress in the household and household members getting angry. And though we don't ask directly about experience with violence given privacy concerns, half of our sample identified violence as a concern for adolescents like him or her, and 63% of those say has increased since the onset of COVID-19. So I hope that this brief snapshot has highlighted the multidimensional and gendered short-run effects of the COVID-19 crisis on Syrian and other refugees in Jordan, with the possibility of long-run effects that are likely going to exacerbate existing inequalities. I think 3 places for young people that we need to think about in terms of policy response. One is on social protection, ensuring that it's reaching the most vulnerable and perhaps pivoting to some alternative ways of distributing help. But of course, this is challenged by both funding limits as well as unfortunate funding cuts. We need to build on the learnings of Makani to figure out ways to maintain learning during this complicated time, and also think of creative ways to promote psychosocial resilience as these communities move into the recovery phase. I'll just leave it here, but here's the contact information for myself as well as for GAGE, website, Twitter, Facebook, and I look forward to your questions a little bit later on. Thank you so much.
Great, thanks so much, Sarah. Okay, and with that, our final presenter, Sam, will focus on housing and housing assistance for Syrian refugees. Thanks so much, Sam.
All right. Good morning, everyone. Can you all see me here? All right, great. So hopefully you can see my screen, so let's get started. Good morning, everyone. Thank you so much for being here, and thank you so much to the organizers for putting this together. My name is Sam Leone. I'm an economics PhD candidate at the University of California, Berkeley, and I'm going to be talking today about an experiment that's trying to understand how housing assistance has helped Syrian refugees in the midst of the COVID crisis. This is joint work with my colleagues Ted Miguel, also at Berkeley, Sandra Rotso at the University of Southern California, and Emma Smith at Harvard. And we've also had the generous support of IPA, which actually funded our data collection, and the Norwegian Refugee Council, which was our implementing partner for this experiment. Now, we'd like to start by highlighting a fact that Rana alluded to in her introduction, which is that there's an incredibly high number of refugees currently forcibly displaced to low and middle income countries. But I think a fact that's not as much appreciated is that a very high proportion of those refugees reside not in the camps that we tend to associate with refugee crises, but in fact in the host communities living alongside the citizens of the countries in which they find themselves. And yet, despite this fact, researchers have produced relatively little evidence of the best ways that the international community can support these refugees who are renting housing in the private marketplace. And we think that COVID has made the need for this evidence even more important because, of course, COVID is associated with, on the one hand, confining people to their homes, and on the other hand, it's created an incredible amount of financial distress, which could heighten the burdens of refugees needing to provide rent. So what we're doing with this project is running a randomized impact evaluation, a randomized experiment to try to understand how a housing assistance program for Jordan's Syrian refugees has helped them in the midst of this crisis. Now, the experiment, which I'll describe in detail in a moment, is very similar to some other famous housing experiments you might have heard of, like the Moving to Opportunity experiment in the United States. But to our knowledge, ours is the first to focus specifically on low and middle income country refugees and the particular difficulties that that subpopulation faces. So let me start by providing a little bit more information about the context in which we ran this experiment, the design, and the implementation of it as well. So Jordan is very much a microcosm of these global trends that I was highlighting a moment ago. There's an incredibly high number of Syrian refugees who have been displaced into Jordan, representing at least 6 or 7% of the country's population. And fully 4 out of 5 of them, or 80%, reside in the host community. And it's only 1 in 5, or 20%, that are residing in the camps. Now, to give you a sense about exactly what that type of housing looks like, we have here pictures shared with us from our partners NRC showing a fairly typical exterior of a home that Syrian refugees would be renting in the northern part of the country. And here's a fairly typical interior shot of a kitchen that a Syrian refugee family has rented. So have these pictures in your mind as we go through the presentation today about exactly what type of housing it is that we're talking about. So given this setting, we think perhaps the most important research question to ask is, what are the effects of providing rental subsidies to support these refugees on the refugees themselves? Does it have positive impacts on their economic well-being, their physical and mental health, or perhaps their children's education? Now, we think another very important and related research question is, what's the effect not on the refugee recipients, but on the host communities in which those refugees live? Are there, for example, spillover effects on housing prices, or do these housing assistance programs perhaps affect social integration between the refugees and the citizens of the host country? We think that's a really important policy relevant question that we're exploring in future work, but today we're going to focus very specifically on the refugee impacts of these types of programs. So what do we do exactly? Well, like I mentioned, we partnered with the Norwegian Refugee Council, NRC, to randomize their existing urban shelter program. When we first started working with NRC, their program was oversubscribed, meaning basically that there was more of a demand for the services they were providing than there was funding to help them. And so we thought this was a great opportunity to run an ethical randomized control trial. And so our RCT has treatment arms that mirror the existing modalities of the program that NRC had already set up. One of them we can think of as basically a high subsidy treatment, in which an amount of money that's approximately $3,000 US at purchasing power parity was given to the refugee families. And that money was spent on a combination of some number of months of rent-free housing, as well as repairs to improve the housing quality of wherever they were living. So for example, if the refugees wanted to work with their landlord to improve the quality of the plumbing in their kitchen or bathroom, that type of thing. There was also a low subsidy treatment valued at closer to $400 US that could be put towards some number of months of reduced rent housing. And in addition, the landlord received a solar water heater that of course the refugees could make use of while they were living in that particular housing unit. One really important characteristic to highlight is that unlike some of those other famous housing experiments like the Moving to Opportunity study, these were not vouchers that the refugees could use to move to different housing in other communities or neighborhoods. These were subsidies specifically for the existing housing they were living in at the time they applied for the program. So to a first approximation, no refugees were moving after having received these subsidies. Now, we randomized at the community level in the northern governorates of Syria, where about 40% of Syrian refugees are currently residing in the country. So we were in the Irbid governorate, which is the northwestern governorate here in green in Jordan, just south of the Syrian border, and in the Mufrat governorate, which is the northeastern governorate here in yellow, also just south of the Syrian border. This is where most of the refugees are living, so it's where NRC had set up its program, and therefore it's where the focus of our study has been as well. Now, one of the things that we're really excited about in addition to those treatments is the amount of data that we're going to be able to collect. So in the long run, we are coordinating with the Syrian Refugee Life Study, which is an attempt to build a representative longitudinal data set of Syrian refugees in Jordan that myself and my other co-authors are working on. And by using the same survey instrument, we're going to be able to collect an incredible amount of end-line information about the refugees who received this housing assistance, everything from economic variables like consumption and expenditures and credit and savings, through to other characteristics like physical and mental health, children's education, and of course, migration. In terms of what we've done so far, in August and September of this year, so during the COVID crisis, but after the lockdown that Nate was highlighting earlier, we conducted what we're thinking of as a midline phone survey, where we ran an abridged survey module to try to understand how our housing intervention was affecting refugees in the depth of the COVID crisis. Now, in the latter half of next year, we're going to go back into the field to do hopefully an in-person full end-line survey that will do once all the subsidies have been dispersed. We actually haven't finished implementing the experiment yet. There's a lot of money that's still going out the door. And also we're hoping that once the labor market changes in the aftermath of hopefully COVID mitigation, we'll be able to find longer term labor market effects coming from our intervention. Now, the last thing to note about implementation before we turn to the results is that we've achieved a very high response rate that we're proud of about 86%. This is due in large part to Rana and her team at Mindset, who's done a really great job of being persistent and making sure we get in touch with the refugees who have been a part of this program. And in addition, for those of you versed in randomized controlled trials, we feel confident that our randomization was done successfully because we have baseline balance on almost all of the measures that we've looked at. So with that, let me turn to what I'm sure you're all most excited to hear about, which is what we find in our data. So today I'm going to present very preliminary descriptive statistics that come out of the data we've already collected, as well as some preliminary results. Now, all of the results I'm going to show you are in fact statistically significant, but in the long run, once we have all the data and once we have all of the experiment concluded, we're going to be doing much more robust, full analysis guided by our registered pre-analysis plan. What I'm going to show you today is just noteworthy facts that jumped out at us as particularly interesting or policy relevant. So let's jump right in. And one of the things that we find in the population that we're looking at is that the vast majority, so 2 out of 3 refugee households, report rental debt, which is consistent with this idea that especially in the midst of the financial distress of COVID, that households are rent burdened and have to sometimes take out loans to meet their rental obligations. But in addition to a large share of households needing to take out debt, the average debt amount is also quite high, perhaps close to about $500 US. And one of the really positive signs we find is that in fact, treatment seems to have lowered the share of households taking out loans, which we think is rather consistent with the fact that we're making this rather large transfer of financial assets to the household that they can put toward their rental obligations. Another stark fact we find is that about half of the refugees that we've surveyed display symptoms of clinical depression per the validated CESD scale. Now, this is a methodology for assessing clinical depression symptoms in surveys like this that the psychology literature has produced. And it really paints a very sobering picture that perhaps is not surprising for a community that is both economically vulnerable and by definition has fled a war-torn country. And again, we see some positive results suggesting that in fact, treatment was able to lower the share of individuals displaying these signs of clinical depression, which we think is a really very encouraging sign for this type of program. And then the last statistic I'll show you is that about 4 out of 5 households that we asked said that their school-age children were not currently engaged in daily learning activities. Now, because we ran our survey in August and September, this was around the time of the beginning of the school year, there could be seasonality effects driving this, but nonetheless, whatever is driving the baseline number, we do see treatment effects where this large transfer of money put toward improving quality of housing and put toward rent does raise the share of households whose children are engaged in learning. We don't have the data to speak to the mechanisms, but you might hypothesize that this is because it frees up some time for the parents to help their children in self-directed learning, or perhaps the quality of the household becomes such that it's easier for children to learn. Now, that's everything I have for you now. I'm really excited to move forward with the discussion. Thanks so much for your attention, and I'm excited to answer your questions.
Great, thanks so much, Sam. And if I can ask all the presenters to put their videos back on again, so ready for the Q&A. So thanks so much, and we've had really great questions coming through in the Q&A chat as well, so feel free to still send your questions through. I have to say, one of the things I found most exciting and interesting about this session has just been the number of different perspectives that we've been able to draw, but also the fact that we've looked at these impacts from so many different outcomes and impacts. So whether it's the economic impacts or the effects on mental health, on education and learning, and violence and tension within the home. So really excited to dig a bit deeper into those. So let's start, Sarah, if it's okay, could you, there's been some interest in just hearing more about the comparisons that you've seen across countries. So could you give us a few insights that you have from similarities and differences from Jordan to other countries in GAGE?
Sure, so I won't be able to do this justice in sort of a short time, so certainly encourage you to read the different products on the GAGE website. So, so our main quantitative samples are in Ethiopia, urban Ethiopia. So this is actually one thing worth pointing out, is that, you know, phone connectivity in rural Ethiopia is pretty low. And so we restricted our round 1 COVID survey to urban. We're going to try to do rural in the next round, but I think that just is an important highlight in terms of, you know, who actually gets counted in part of these discussions. And I think Jordan is sort of nicely unique in that most people do have phones, and you know, as Sam said, mindset persists, so we're able to reach many of them. So we have urban Ethiopia, Bangladesh, including a school-based sample, a sample in Dhaka, and a sample of Rohingya refugees and nearby host communities, and then the Jordan sample you talked about. We're adding a Palestinian sample now. So I think, you know, one thing to highlight is just the vast difference in the sort of original health impacts of COVID and the lockdown are just vastly different across the three contexts, kind of from Jordan, which really went into a pretty severe lockdown really early on, to Bangladesh and Ethiopia that have reacted quite differently. And so I think that has some influence on the findings. So just maybe 3 things to quickly highlight is I think the access to all kids and parents are trying to do their best to have some kind of learning, but Jordan is the only place we actually have high percentages who are engaging with the formal system, whether that's directly connecting with teachers, listening to the Ministry of Education broadcast. We just don't see that in other settings. I think in Bangladesh, so here I think we said about 75% are listening in some way or another. In Bangladesh, it's under 10%, in Ethiopia the same. And so in those contexts, people are much more reliant on parents and books they have in the household than any kind of formal connection. And I think, you know, as I noted, that's likely, you know, for households where the parents are illiterate, it's very challenging in terms of what support they can provide for their kids. And so I do think the vast difference in education is one thing worth highlighting. The other, another piece is I think the married girls are facing challenges everywhere. I think this is really, you know, their lives are complicated as is, and then this I think has really exacerbated that. And so I you know, not really being able to connect with anyone outside of the household, having now their husband home all the time, kind of additional demands on their time, and also, you know, not able to get vaccinations for their kids, not able to get SRH help if they're pregnant. And so I think that's a particularly vulnerable population that is going to face challenges. And then along with that, I guess the third thing I would highlight is I think, you know, I think being at home, there's sort of a positive and a negative. I think there are many adolescents that are actually feeling like they're getting more support than they normally do because they're, at home and interacting with their parents a lot more than usual. And in fact, we actually see a large chunk of our adolescents saying that for girls in particular, that this was likely going to delay early marriage. And so however, kind of on the other side, we similarly see a strand of girls who are concerned about getting married faster and also, documenting the increased stress and kind of violence in the household. And so I think there's, these kind of dichotomies in terms of the experiences adolescents are going to have it at home. And that's something I want to, we really want to follow over time is sort of, I think there is some, for some households, I think there's going to be some protective effects of the pandemic. And for others, it's going to go in the opposite direction. And I think that's going to be really interesting to look at. So I could talk all day about this. But I think those are kind of a few highlights.
Terrific. Thanks so much. So Sam, maybe moving to you then on the, so as you mentioned in your motivation for the study, there's so little that's known about this. So it's just fascinating to see both the intervention and the fact that there's a rigorous study of it. So can you talk a little bit, it struck me when you presented it that it's also very expensive as far as in terms of how interventions generally look. Can you say a little bit more about how you're thinking about cost effectiveness and how that will feature in the study?
Absolutely. I think that's a centrally important question when it comes to the policy implications of a study like this. So we are absolutely planning to do a cost benefit analysis or a cost effectiveness analysis as we move forward, guided by our pre-analysis plan in the coming months and as we get more data. So what that's going to look like is we've already today presented some of our preliminary findings about the benefits, but once we have a rich understanding of what those are in terms of the financial benefits to the households, or in a sense, in monetary terms, the physical and mental health benefits and the education benefits, that'll be one piece of the puzzle. Then we'll turn to the cost side. As you mentioned, it is a rather, I think, more expensive than some other interventions out there. So we'll have to think about how expensive it is to implement the program, not just in terms of the transfer of funding to the refugees, but also the implementation or administrative costs of NRC or other organizations that would be involved in this. And once we have all that information, we can put it together and really think about what is the return on investment for this type of program compared to what we see with other interventions out there. And I think that's really centrally important for policymakers, and it's exactly where we're hoping to go with this project. One subtle thing to mention about that, as I mentioned, we have this high subsidy and low subsidy treatment. Part of the reason that's included in our experiment is precisely to get at cost effectiveness, to see, we have one intervention that's, some multiple more expensive. Do we see the same amount increase in benefits? So that's exactly where we're going with this. We're really excited about the benefits we're seeing so far, especially in the mental health domain, since that's such a hard lever to pull. But you're absolutely right that I think that's the next step.
Terrific, great. And then let's maybe move to Nathaniel and Rana. So it was great. I think in every presentation, everyone mentioned some of the pivot that they had made in terms of COVID, or some of the changes or strategies that you'd had to adopt in order to conduct the research within the context of the lockdown and safety and security concerns. Nathaniel, the mobile, the data tower and the mobile tower data use was particularly interesting too. Can you and Rana maybe both comment on just some of the kind of pragmatic implications of this? So how have you, are there specific permissions that you needed to get? Were there specific additional changes in strategy that you needed to ensure to make sure that both respondents and interviewers or enumerators would be safe?
If Nate will start, I will follow.
Sure, my pleasure. Yes, so this project depends on an existing project that's looking how Syrian refugees make migration decisions and where they choose to live and work, and the impact for both refugees and incumbent residents. So some of this work with the mobile phone data had been in place and building up. And so luckily, when we were thinking of how to oversample and reach people, we could do this. Because otherwise, to reach the Syrians with just a phone survey, if you don't have that population already, you would need quite a large number to find enough people to get. So this was very fortunate for us. In terms of the protections, yes, we had thought about going into the field earlier and had been working on that. And at that time, we were putting in place for enumerators to work from home. They needed to have internet access to do that, so to arrange for hotspots. All of this to try to increase safety and then also to comply with lockdowns. In the end, I'm not sure if that's the direction it went, because the survey, as I said, went in July and September. But then also working closely with the independent review boards to make sure that we have safety and also privacy of everybody involved. And so we have quite an extensive set of protocols in that dimension.
Great, Rana?
Yeah, so I'm going to be talking a little bit about the logistical aspect of data collection with refugees under COVID-19. The permits were halted and we were unable to reach families who needed to be visited for different types of research that we were conducting, whether it was validation or it was just for research purposes. And it resumed back in June, where we started, we resumed our work. However, out of precaution, so many research activities that were not required to for our team to go into the homes of the respondents, we resumed them via phone. And I discussed that a little bit. We had to break down some of the activities into several phone calls. In terms of response rates, it depends really on the population we're surveying. With the refugee population, we did not suffer from lowered response rate by much, so it was a slight drop, because for many refugees, the research activities were often related to bettering their situations, whether to hear about their needs, their eligibility for assistance. However, for the local population, if we're surveying Jordanians with under COVID-19, the response rate has dropped slightly, there is another issue that we find to be quite challenging, which we were unable to establish rapport between the enumerators and the research respondents, which allowed us previously to be able to refer cases that needed assistance to our partners and service providers. So this, with phone surveys, with our inability to reach their homes, it has not allowed us to do that much. So we were unable to identify within the homes if there are any cases that needed referrals. Finally, of course, the whole layer of hardship on the interviewers in the field, having to wear masks and face shields and having to conduct the interviews outside of the home are all extra layers that makes an already difficult job even more difficult. So this is how it is to conduct research under COVID-19.
Great, thank you. So there's a question that's come through on the chat about the connection between housing and so the same way, Sam, that you'd connected housing to mental health and psychological well-being, whether it will be possible to make those connections between housing and educational activities or learning, given obviously the need for physical spaces to learn. Is that planned to be part of the study? And Sarah, I don't know if that also came through as part of the GAGE analysis.
Yeah, absolutely. That's something that we're planning to look at. And as I mentioned, we're going back into the field very soon to collect even more data on our population once the experiment has been fully implemented. But just to say in the meantime that part of the reason we're really excited about this is it's not just that there's been relatively little research trying to understand the best way to house refugees in low and middle income countries. It's that there's a lot of excitement around housing interventions, I would say, in the humanitarian aid space. And I know this is definitely true of NRC, because I think there's a belief that is really supported by the evidence we have so far, that housing can be a little bit of a, I don't want to say silver bullet, but it has a lot of bang for your buck potentially, in the sense that you're not just providing housing, but in providing housing, if you're making the quality of your housing better, you could have very direct physical health effects. If the environment is more comfortable, you could have mental health effects. If you're easing rent burdens, that could also have mental health effects. And then of course, regarding education, there's probably many mechanisms at play. I mentioned a few in my presentation about if you have parents who are less rent burdened, perhaps they have time to spend directing their children in their educational activities. Perhaps the space itself becomes more conducive to learning if there's less noise or if it's better ventilated. So I'm not particularly an education expert, but I can say that our team is thinking along these lines really significantly. And we're excited to use the new data that we're going to be collecting as part of the Syrian Refugee Life Study to try to understand what are these mechanisms through which housing doesn't just have direct financial effects, but in a sense also buys us a lot of other positive impacts and other social dimensions of refugees' lives.
Great. Sarah, is there anything you want to add from the GAGE studies on that?
I can just add that prior to COVID, analysis suggested that participating in the Makani program did improve not only access to formal education, but also mental health outcomes measured by the Primary Health Questionnaire 8. And so it'll be interesting to see now how that interacts with COVID, both currently, but then also, as schools reopen and kind of we get to that return piece. So I think, mental health, resilience, anxiety is all going to be kind of closely connected to all of these things. And I think, great that Sam is working on the housing program to think of sort of possible interventions that may not only tackle housing, but then have these knock-on effects on these other outcomes that we care about. And that's why your cost benefit is going to be tricky, because you're going to want to, measure across multiple outcomes, right? Which is, why cost benefit as opposed to cost effectiveness may ultimately be critical for your calculations.
Great, terrific. So now thinking about, so I feel like we've heard a lot just as we've got 5 minutes left. We've heard, I think, everything from what some of the direct economic impacts are of the lockdown itself into some of these different perspectives on mental health, on education and learning, violence, and for different segments of the population. So I'm wondering, Nathaniel, I thought it was, provocative as well when you said, the lockdowns are life-saving, but there's also a cost to them. So looking ahead now, if we're expecting things to ebb and flow in terms of the pandemic itself, and then thinking about policy responses, what would be your policy suggestions just based off where you are right now? I know researchers are often reticent to put too many policy recommendations forward before all of the studies have been concluded. But if for each of you, if you could think about what suggestions you may have based off the findings that you have today, thinking ahead in terms of preparing for either future waves or just thinking about what we have learned from the waves that have passed.
So I'll begin. I think one thing that we see is that workers that one could consider being disadvantaged in some ways, refugees count in this, low wage earners, lower educated workers, to some extent the youth, from the evidence we've seen from our data. These are groups that have been hit. And so when we think of targeting social safety net type programs, this is an area that can be focused on right away. I think that we're going to also find a lot as we trace out the trajectory of these recoveries for different groups into the future, and as we also see how people are adjusting where they live and work in respect to the changing economies. How easily do you reestablish your working relationship? Do you go back to your same job, or are you finding different jobs? And are some groups able to do that easier than others? And then what types of programs could be put in place to assist that transition from losing your job during lockdown, during pandemic, and then finding your next job?
Great. Sarah?
Sure. So I think I highlighted on my last slide a few things. I mean, I think, Jordan has great social protection systems, but frankly, they're underfunded. And so how are we going to ensure that those households that are currently supported remain supported, and that also the many households that need social protection support and aren't getting it, get it? And so this probably is something Rana can speak to a bit more than me. And so I think that's just going to, continue to be a challenge for refugees in Jordan. I think given the good access to technology in Jordan, leveraging that, but then kind of, again, echoing Nate's points, how do you then also make sure that doesn't exacerbate existing inequalities and tackle that as you go back? And then I do think, paying for young people, paying particular attention to when schools open, are kids going back and who isn't, and how do we think of programs like Makani and others that can help then interact with those kids who are not re-engaging with school to ensure that they return. And then I guess, what does this all mean for the job market for young people in Jordan over the next 5 to 10 years?
So in terms of policy implications, I think there's really reason to be bullish on a program like this that provides some housing assistance for all the reasons we've already discussed. And so it certainly is the type of intervention I think should be on the radar screen of different IGOs and NGOs thinking about serving a refugee population in Jordan or elsewhere. But I think there's also reason for caution. And, as I mentioned before, our intervention and our preliminary results are rather preliminary. We haven't finished implementing the experiment. We haven't finished collecting all of the data. So there's a lot of work to be done there. In addition, it's not going to be enough just to show that there are benefits of this program. We also have to show that it passes a cost-benefit test, as Sarah was mentioning before, and cash benchmarking and things like that are going to be very helpful as a part of that process. I think there's also an opportunity for work that does more to explore not just the private market in which refugees are renting housing, but also thinking about public provision of housing, a la camps or other models of housing provision. Thomas Jin at the Center for Global Development has done a lot of work on that, trying to understand the different options for housing refugees and zooming out to think about what's the best way to be providing these housing services. So far there's reason to be bullish, but there's a lot more work to be done to figure out where scarce resources should be flowing most.
Great. So we started with Rana. Oh, I hope Rana's still there. She's gone off camera. We started with Rana, so I was hoping we could end with Rana as well. Rana, are you there? We may have lost Rana. Okay. Well, with that, thank you so much. I'd like to thank all of the panelists for their excellent contributions. Okay, Rana, you're back. So maybe could we have closing words from you? You opened it so beautifully. So any closing thoughts from you as well in terms of policy recommendations or next steps?
Honestly, I think my colleagues have covered most of the points that I wanted to cover, but it is very important that there is more collaboration, interagency collaboration on producing more evidence regarding this topic. And I'm going to leave it there.
Great, thank you so much. So we're at time, but I want to thank all of our panelists and thank all of the attendees and participants of this webinar. There will be one more in this series with our co-hosts at the Joint Data Center and CEGA. So we'll look forward to seeing you at the next one. Thanks so much. Bye-bye.
Thank you.